Hello everyone, I am Dr. Neha Patil from the Department of Oral Medicine and Radiology. The topic, a small topic for discussion, regressive changes of teeth. By regressive changes, we generally mean that these are a group of changes which are seen on the dental tissues which occur because of non-bacterial causes, resulting in wear and tear of the tooth structures with impairment of function. So whenever caries is not the basic cause for loss of tooth structure, these changes can be categorized as regressive changes. The most common among these are attrition, abrasion and erosion. These are quite rampantly seen and are very easily clinically noticeable. The very first one, attrition. This is mechanical wearing away of the incisal or occlusal surface as a result of functional or parafunctional movements of the mandible. So what we mean by this is, this condition or this wearing away of the tooth structure could be physiological, that is because of age or because of a certain mandibular intercuspation of the patient, or pathological. It generally is seen as a polished facet on the cusp tip or on the ridge. There is flattening of the incisal surfaces, which depends upon the degree of attrition, that there, in severe cases there could be complete loss of the entire crown with only root pieces visible, or maybe in minor cases there would be only loss of the incisal edge with either dentine being involved or not involved. And there is discoloration, which is either because of the underlying dentine which is imparting the color, or any superficial stains which the teeth acquires in the process. The next one, abrasion. This is abnormal tooth surface loss resulting from direct friction forces between the teeth and external objects in presence of an abrasive medium. So this is completely not physiological but is pathological as compared to what we saw in attrition, and here the cause is any external medium, most commonly an abrasive thing, which is leading to the loss of tooth structure. So what we mean is external agents, which is most commonly any brushing technique or a abrasive agent which the patient is commonly using, and this causes a V-shaped or a wedge-shaped ditch which is mostly seen at the cervical edge of the teeth. Here there is a sharp enamel edge which we can very well appreciate in the clinical picture, which is visible, which helps us in differentiating the erosive lesions from the abrasive lesions. So a sharp enamel edge along with a V-shaped wedge at the cervical aspect of the tooth structure is mostly suggestive of an abrasive change. The last one, erosion. Erosion is wearing away or loss of tooth surface by chemico-mechanical action. By chemico-mechanical, we either mean intrinsic or extrinsic. Intrinsic are cases wherein the patient has chronic acidity, or because of the reflux, the saliva which is lower in pH can cause wearing away of the tooth structure, and extrinsic because of more consumption of acidic beverages or too much use of lemon. All this can lead to chemical erosion or wearing away of the tooth. Here, labial and buccal surfaces are most commonly involved, as in contrast with abrasion, which is mainly seen only at the cervical surface. Here, an entire labial or buccal surface is involved, and the lesions of erosion are more smooth surface as compared to the abrasive lesions which are wedge shaped, and there are chances of visibly seeing a pink spot, like what we can see in the picture over here. Pink spot is the exposed pulp chamber which is seen because of the wearing away of the superficial enamel and dentine. We present a clinical case of a patient which show all these three lesions: attrition, erosion and abrasion. So here we can see the occlusal surface which show loss of the occlusal as well as incisal edges, which is typically seen in cases of attrition. You can see the occlusal surface of the molars and the premolars, which show complete loss of enamel. Here we see the wedge shape or V-shaped cervical defect, which is very pathognomic of abrasion. Same wedge shape and V-shaped defect is seen in the lower premolars, which is pathognomic of abrasion. And if we appreciate the buccal surfaces and the labial surface of the teeth, there is smooth surface defects which are seen here, which are basically lesions of erosion. Attrition, abrasion, erosion are very common regressive alterations of the teeth which we usually see. The clinical symptoms is mainly hypersensitivity or pain in case where the pulp tissue is exposed. And so clinical differentiation between the three is very important, and this will lead to the subsequent proper treatment plan for the patient. Thank you.